This is Winifred O'Connell for the Introduction to Health Consumerism 100, a timeline of notable events of the history of United States healthcare. In the 1890s, workplaces which required manual labor hired doctors at low rates to care for injured workers. This stands as a predecessor to employer-based insurance. In the 1920s, teachers were encouraged to subscribe to a plan which provided up to a 21-day stay in the hospital for just $6 a year or 50 cents a month. Other employers saw the popularity in the plan and the benefits that it provided and began to follow suit. This became known as catastrophic care insurance. In 1936, Massachusetts General Hospital opens the first anesthesia department, easing the pains of surgery and hiking the costs of hospitalization. In 1939, insurance plans offering extended hospital stays at low rates became known as the Blue Cross plans. These Blue Cross plans were originally from a nonprofit organization. In the 1940s, Copenhagen opened the first intensive care unit, or ICU. It was complete with ventilators, extending life for those suffering from many ailments. The Blue Cross plans, however, weren't enough to cover these new machines and new technologies, prompting change. During World War II and up to 1945, companies began offering major medical plans covering extensive care, but not routine doctor visits. These visits were still out of pocket. 1940 to 1955, the number of Americans enrolled in insurance plans rises from just 10% to 60%. Blue Cross and Blue Shield became the most prevalent, offering coverage for both extensive and routine care visits, making it a highly desirable plan. In 1994, Blue Cross and Blue Shield became a for-profit organization, leading to the second largest insurer in the United States called WellPoint. WellPoint is still active today. In 2010, only about 64.4% of every dollar contributed to a healthcare plan is recorded as going to actual health care. The remaining percentage goes to lobbying, administration, and the paying out of dividends, causing plan subscribers to question its good doing. In 2010, the Affordable Care Act is passed. The Affordable Care Act is a plan enacted to make sure every American had access to health insurance, but it does not have any control over the massive charges billed to insurance or the varying costs of the same treatment in different locations.